Hello, everybody, and welcome to week 5. We're going to talk a little bit about risk reduction. Risk reduction is important for behavior change. Interventions will be more successful if risks are reduced and protective factors are increased. Risk reduction is finding out what within the community contributes to the problem you're trying to prevent, and then working to cut down on those factors. And protective factors are the things that keep whatever it is you're trying to prevent from occurring, and they generally help to cut down on those risks or they actually counteract those risks. The example given in your readings was substance abuse among young people. So, in this example, the risk factors are the elements that cause or lead to the behavior. So, the economy, availability of substances, family issues, or peers who happen to use drugs. The protective factors are the things that counteract those risks or they prevent them from occurring, which is positive role models, employment, or availability of drug free activities. In order to understand the risks that you need to reduce, a risk assessment needs to be done. Now, a risk assessment, it identifies the events and exposures that may be harmful to humans and it estimates the probability of them occurring. People understand statistics. Even though the thought of them may make you cringe, you may have cringed just at the word statistics as I said it, they do show us information and people believe that information that they're shown. That is the probability of an event happening to us or the probability that a risk is going to bring us harm. It is still important to understand risk perception, though, and that is the concept that people's concerns about their risk is affected by certain associated factors or psychological factors. So it basically is taking into effect the idea that our assessment and our statistics isn't going to be the only thing that motivates people. It helps to explain the irrationality of our perceptions, the irrationality of our behavior. Risk perception research has shown that people's concern over risk can be affected by more than just the data. An example can really be found in adolescent populations. Adolescents tend to engage in actions that they know have a high risk, like smoking, drunk driving, or unprotected sex. And understanding their perceptions will help to better decrease this behavior. An example is smoking. Let's take smoking. Surveys have shown that teenagers know the risks of smoking and they understand that smoking leads to cancer and death, but they perceive that they're not at that risk because they plan to quit after a couple of years and they underestimate the addictive nature of nicotine. So it's important to understand their perceptions as well as the assessments of their actual probabilities in order to really truly decrease risk. And this leads to strategies and tactics. Just a little difference so you guys understand the difference between a strategy and a tactic. A strategy is a broad step in a plan that wants to accomplish a specific goal. Well, the tactic is that specific step that you take in order to complete the strategy. It's really important to involve the community when you're doing your risk reduction. And the reason for that is involving members of the community and the target population itself really is essential for success. It helps you to truly affect change by changing the norms and values within the community. This creates more support, and more support means more success. You'll also be able to better understand what resources you have and what the population risk perceptions are. And this will help you to gain that support from the public that is so crucial to change behavior. Involving the target population will help to establish trust, which will help to adopt lifestyle changes. It will also help you to understand what your community is capable of, and the community itself will better understand why they have this need. And all of this leads to better and long term behavior change. That is it for now. Feel free to move on to the soft chalk lesson, which is going to go into more specific oral health risk assessments and risk reduction.